Have you heard that a corneal infection caused by herpes simplex virus is one of the main causes of blindness in developed countries? Did you know that 9 in 10 adults have been exposed to herpes simplex virus? Did you know that 1 in 5 people after an ocular herpes simplex infection can develop a chronic infection with the risk of blindness? By the end of this podcast, you'll know what herpes simplex keratitis is, how to identify this infection, and what to do to prevent this infection. First, I will give a brief introduction about corneal infection caused by herpes simplex virus. Next, I will chat with Professor Stephanie Watson, a corneal specialist and the head of the Corneal Research Group at the University of Sydney SafeSight Institute, and the head of the corneal unit at the Sydney Eye Hospital, who will tell us how to identify a corneal infection caused by this virus and will give us some recommendations on how to prevent this infection. And later, we will explore the research on the treatment for herpes simplex keratitis. I am Maria Cabrera, a researcher at the University of Sydney SafeSight Institute. Welcome to the Sydney Eye Podcast. Today, we're going to talk about herpes simplex keratitis. Remember that a corneal infection is also known as keratitis. There are 2 types of herpes simplex virus. Type 1, which causes infections in the face, for example, the common cold sores around the lips and the nose. And type 2, which causes infections in the genital area. An individual usually is infected by the herpes simplex virus during childhood. Only 1 in 100 patients present with signs of ocular infection. The herpes simplex virus type 1 is transmitted via direct contact with sores and saliva of a patient with the infection. The ocular infection generally manifests with some blisters on the eyelids or surrounding skin, red eye, and lymph nodes in front of the ear within a month after the infection. After the initial infection, the herpes simplex becomes inactive in the body. Recurrent corneal infections occur when the virus is reactivated and is transported down the nerves infecting the cornea again. Reactivation can be triggered by trauma, fever, or environmental factors such as windy days or sunburn. Recurrent infection can affect the eyelids, conjunctiva, cornea, or retina. Herpes simplex keratitis is an important cause of blindness in developed countries. 1 in 5 people who have had ocular herpes simplex virus infection are at risk of having recurrent infections, which may cause scarring in the cornea, leading to blindness. 1.5 million of new cases of herpes simplex keratitis were estimated in 2012 worldwide. Patients require frequent visits to an eye doctor, resulting in significant loss of time at work and reduced productivity. Patients see an eye doctor on average 4 times during the first episode and 6 times when the infection recurs. Corneal transplantation may be required when multiple recurrences of herpes simplex keratitis cause corneal damage. Over 1,000 surgeries are performed annually in the United States in patients with herpes simplex keratitis. In Australia, 1,100 corneal grafts have been performed due to herpetic eye disease since 1985. Now let's welcome Professor Stephanie Watson, a corneal specialist and the head of the Corneal Research Group at the University of Sydney SafeSight Institute, and the head of the Corneal Unit at the Sydney Eye Hospital. We're going to chat about how to identify this infection and what we can do to prevent it. Thank you, Professor Watson, for joining us again in our show today. Welcome.
It's nice to be here.
How often do you see patients with a corneal infection caused by herpes simplex virus?
Herpes simplex keratitis is the commonest cause of corneal blindness in the developed world. So every day I'm in practice, I usually see at least one patient with herpes simplex keratitis. It's pretty common. When we did an audit of our corneal clinics at the Sydney Eye Hospital, we found that herpes simplex keratitis was the second most common reason for patients to visit there.
Well, it seems quite a common ocular infection then. What type of patient usually has this condition? Young, old, with any medical or ocular history?
Look, it's interesting. Look, almost any age of patient can have or have had herpes simplex keratitis. It starts as an acute condition, and then you can get a chronic form that can go on for many years. So someone might come in who's in their 60s who actually had their first episode in their 20s. I've also seen children with herpes simplex keratitis. So it can affect all ages, but over time, people may get more and more episodes, and then it can become a chronic condition.
So, listeners, this is a key point. Any patient, child or adult, can have herpes simplex keratitis. Then, Professor Watson, what symptoms do patients or parents need to watch out for?
Look, if they get a red eye that's not resolving quickly, if they're light sensitive or their vision goes down, it's more common in patients that have cold sores on their lips. And those cold sores are generally caused by the herpes virus, and it's the same form of the virus that causes cold sores on the lips as it does in the eye.
When does a patient with a red eye need to see a doctor? How many days after the onset of symptoms?
Look, I mean, a red eye that's not getting any better, I'd probably get it seen to quicker than a week, if it's not going sort of after a day or two, because there can also be very serious causes of red eye, including herpes simplex. So I would recommend, red eye not getting better after a day or two to have that eye checked. If there's pain, have it checked sooner. And if the vision's down, have it checked very soon.
Why do you think people should know about herpes simplex keratitis?
It's important because it's really common and it can lead to blindness. And once you have herpes simplex, it can come back again. And over time, it can cause more and more scarring of the cornea and therefore more and more vision loss. It's important patients are aware or know that they have herpes simplex keratitis. So if they get a red eye again, they can come quickly so they don't lose more sight from scarring and vascularization of the cornea, and it can get treated properly. It's important if patients know about the condition, so if they do get a red eye, they can consider it, particularly if they've got a cold sore.
Now let's talk about treatment. What treatments are available for this infection? How is usually treated?
The main treatment, particularly at first presentation, is antiviral treatments. And these inhibit the replication of the virus so that the condition then can resolve faster. If it's a recurrent condition, as well as the antivirals, you might also need to use some topical steroids. The herpes virus, when it causes keratitis, causes inflammation and vascularization. And steroids can have a role in resolving the inflammation and vascularization to prevent further vision loss. But if you're using steroids, they generally need to be monitored closely. The steroids can put the pressure up in an eye, they can cause cataract, and if they're not given with the appropriate antivirals, you can get corneal melting. Look, rarely in herpes simplex keratitis, the cornea may be so badly affected that it melts away, and then you can get what's called a perforation where there's a hole in the eye, and this would need urgent repair. Now, there's a number of ways that we repair corneas with herpes that have perforations. If it's a small one, it may just be able to be treated with what we call a bandage contact lens, which is a contact lens that goes on and is used literally as a band-aid or bandage. If the hole is bigger, around 2 to 3 millimeters, you could then do what's called a gluing. We have it almost like super glue for the eye that you put on, and that can stop the leak. But if it's bigger again, you probably need to do a corneal graft. So we use tissue donated, and we stitch this onto the eye to heal the leak. So there's a range of treatments patients might need depending on how severe the herpes is and at what stage it is.
Indeed, this infection can cause severe complications needing even a corneal transplantation. Can the patients do anything to prevent this condition?
Sometimes it's thought that being run down or fatigued or being immunosuppressed may actually increase the risk of the herpes virus manifesting itself as a disease, that is in the eye or on the lips. Because most of us actually have been exposed to the herpes virus. And if you look at the blood of people, say when they're 60, the majority of us actually have antibodies to herpes simplex, indicating our previous exposure. But only 1% of the population manifests as herpes as a disease. We think that maybe immunosuppression, such as if you've had a kidney transplant, might make you more prone to have herpes simplex keratitis. Actually, having a corneal graft can also increase your risk. And this is probably due to immunosuppression and the use of steroids. Patients that are at risk may be put onto oral antivirals to help prevent recurrent attacks. There's very limited evidence, but there's been some speculation that a diet rich in lysine and low in arginine may have some role in reducing episodes of herpes simplex. But this still remains to be proven in larger studies. So I think in summary, look, take care of yourself, have a fit and healthy lifestyle. If you are on immunosuppression, find out if you need to be on antiviral prophylaxis, and maybe just consider whether your diet is ideal. This is probably what you can do to try to prevent episodes.
Well, Professor Watson, this was very informative. Thank you so much for being on today's episode.
Thank you, it was a pleasure.
More on herpes simplex keratitis up next. But first, we have a question for you, the listeners. Have you had a corneal infection caused by herpes simplex virus before? If so, how was your treatment? Were you treated as an outpatient or admitted in a hospital? What medications were you prescribed? Email us at sydeyepodcast@gmail.com or share on Twitter with the hashtag sydeyepod. That's hashtag SYDEYEPOD. Now, more on the research of treatments for herpes simplex keratitis. The cornea has 3 layers: the epithelium, the stroma, and the endothelium. When the herpes simplex virus infects each layer of the cornea, the infection manifests differently. The appropriate therapy for each type of keratitis depends on the correct diagnosis made at medical examination and whether they had a previous infection. Sometimes doctors can perform a swab on the eye to detect the virus. At the Sydney Eye Hospital, Professor Watson and I led a group of corneal and uveitis specialists and pharmacists to develop, implement, and evaluate a clinical guideline for the treatment of this condition. In 2014, we found that there was a diverse range of initial therapies given in 73% of clinicians, prescribing the initial antiviral therapy according with the recommendations of clinical trials. Next, we created the local guideline based on the clinical studies and available antivirals in Australia. We distributed the guidelines through lanyard cards, put up posters in consultation rooms in outpatient clinics and in the emergency department, sent a PDF document via email, and uploaded the guidelines on the hospital intranet and on the SafeSight Institute website. This guideline outlines the initial therapy for epithelial keratitis, stromal keratitis with and without ulceration, endothelial keratitis, keratouveitis, prophylactic therapy, adult renal dosing for oral antivirals, recommendations for pregnancy and for children. We have also sent out the guideline to clinicians who have requested them for their practice. We also evaluated the uptake of the guideline among clinicians. We did a medical records audit and ran a survey. Most of the clinicians were aware of the guidelines and used them at least twice a week. There was an increase from 73% to 80% of clinicians following the treatment recommendations for herpes simplex keratitis after implementation of the guidelines. I have also created 2 videos about herpes simplex keratitis which are available on YouTube. You can find the first video as educational video to support diagnosis of herpes simplex keratitis. In this video, I highlight the signs of each type of keratitis for clinicians to correctly identify the type of keratitis, which will help them to prescribe the appropriate therapy. You can find the second video as educational video to support the treatment of herpes simplex keratitis. In this video, I explain the treatment guideline. In summary, herpes simplex keratitis is a corneal infection caused by the herpes simplex virus. It is one of the main causes of blindness in developed countries. Individuals usually get the virus in the childhood, but only 1% develop ocular infections. Children or adults can have keratitis. It usually presents with a red eye associated with cold sores on the lips. If you also present pain in the eye or loss of vision, please see an eye doctor immediately. Recurrent episodes may cause scarring on the cornea, leading to blindness. To prevent recurrent episodes, have a healthy lifestyle, and if you have any immunosuppressant condition, such as a previous organ transplant, including a corneal transplant, or use of chronic steroids or immunosuppressant medications, or any previous ocular surgery, you may need oral antivirals to prevent recurrent episodes. Please consult with your doctor. I am Maria Cabrera. Thanks for joining me today in the 3rd episode of the Sydeyepodcast. If you have any questions, comments, or suggestions, please send them to sydeyepodcast@gmail.com and connect with us on Twitter @Cabrera Marie. It's CabreraMarie, or at Corneal Research using the hashtag SYDEYEPOD. Until next time, bye!